You know what else happens that drives me crazy? I could go off on this topic.
Let's go off. So we always end the Beauty Outlaw with champagne.
Oh, heck yeah.
We're going there.
We're going to go there.
Welcome, everybody, to the Beauty Outlaw podcast.
Okay, welcome to the Beauty Outlaw. Here we go again. We've got a great episode, and I know that this year, 2026, we're in our third year of the Beauty Outlaw, and this year I'm bringing things close to me, things that have happened to me, things that I've enjoyed, processes I have to take in my aging process, and just in health and fitness and wellness. And one person I want to introduce you today is my vagina doctor. She is here. She keeps my vaginal health great, along with my hormones. My hormones are important too, but I'd like to welcome my pelvic floor physician. I call her, she's a doctorate as a physical therapist. I would like to introduce you all to my favorite girl, Olivia Van Guyse. Welcome to the podcast. This has been a long time in the making.
It has been. Thank you for having me, Jerry. Happy to be here.
What I'd like you to share with everybody is what your credentials are, first and foremost, how you got started in this, where you grew up, everything about Olivia.
Yeah, so a little bit about me. So I am a doctor of physical therapy. I specialize in the pelvic floor, but also do a lot of orthopedics too. You can't do pelvic floor without all of the other things. I'm originally from Wisconsin, and I actually only moved out to Orange County a couple of years ago here.
Oh, wow.
Yeah,
I didn't know that.
I know. I don't
You're
have the
like
accent, do I?
girl.
Yeah, right. So I've been told. But I got my undergrad degree from the University of Wisconsin-Madison. Go Badgers!
Yay.
In kinesiology, and then I got my doctorate in physical therapy from Rosalind Franklin University, which is in Chicago.
So, what is your family still in Wisconsin, or did everybody?
Yeah,
all my
family is still in the Midwest, but I do have an aunt and uncle who live in the Long Beach area, so I had some roots here in the beginning. But
What brought you out here?
I've always had an appeal to Southern California, just with my cousins living out here.
Yeah.
I just always loved the vibe, saw myself here a little bit more, and then just got a great job opportunity and mentorship opportunity with Nicole Cozine, who is the pelvic floor therapist who owns the clinic that I work at, Pelvic Sanity. And it was just kind of a perfect storm, perfect excuse to get out here.
Well, I know that you take care of people's vaginas and men as well.
That is
correct. And we'll
correct.
get to that. But you also are somewhat of a coach.
I am.
To wellness, health, food, nutrition, because it's not just about orthopedics or the pelvic floor. It's about your overall being, and I love that about you. And you really have made a dent, I think, in some women's health, especially young girls. I think you've been able to do that through TikTok.
Definitely.
TikTok is really your generation and younger, and they need a space where they see the whole picture.
100%.
How did that all happen? When did you decide I'm going to turn the camera on and do this?
Yeah, it's actually an interesting story. So yes, I'm a physical therapist, but then I also do fitness and nutrition coaching. That's, my own business through LiveWellVG. That's like my socials. And I've been doing that for the past almost 6 years now. And it kind of started on accident a little bit. It was COVID. I was quarantined with a couple of roommates, and I was like, TikTok is for kids. I'm not downloading that. I thought I was above it. And then I was posting recipe videos, just healthy recipe videos on Instagram anyways, or just photos of my food. And my roommate was like, Olivia, you should post these on TikTok. And I was like, I'm not doing that. That's for dancing and whatever they're doing on there, right? And I was like, you know what? I'll try it. I posted, it was like a chia seed pudding recipe video, and it got 1 million views overnight. So
You woke up and go,
yeah.
wow.
So I just took it and ran with it, started just continuing to post healthy recipe videos. Then during my gap year, I worked as a personal trainer and nutritionist. So decided to incorporate some exercise tips on there. And then when I went to physical therapy school, my personal training clients were like, can we still work with you? I love the workouts you write me and the nutritional stuff. So I was like, yeah, let's do it virtually. So that's how my virtual coaching business began. And I did that all throughout physical therapy school and still do it today. That's how that kind of started.
Wow. So you kind of went from I love these stories because not everybody seeks out to be a TikTok influence person or gain a lot of business outside of TikTok. TikTok's a whole different beast in itself.
Totally.
And you're actually a professional outside of your TikTok profession, right?
Yes, not just an influencer. Nothing wrong with that, but
right. But that's what I think
avenues.
Makes it so special. Now, here's my question to you. How do you walk that fine line of medical advice or guidance with what's happening or could happen on TikTok? Because you get a lot of people asking you questions.
Yeah.
How do you handle that?
Yeah, it's tricky because when I get comments and people are, I'm dealing with X, Y, and Z, like, what should I do? I want to help and I want to be able to help everyone. But unfortunately, without the big picture, without an entire assessment, as you know, you just can't. I can't diagnose through the phone, through the comments section. So I will try to either lead them to get, whether it's working with me as a coach or go to a doctor, get some scans done, get an entire evaluation done first when it's a specific or individualized question that they have. But regarding like giving medical advice, I keep it general. If you have these symptoms, you may want to look into this. Always ask your provider about your particular scenario. I'm never diagnosing, prescribing, or anything like that. But it is difficult because people want clear-cut answers, and the answer in medicine is always it depends, which is not sufficient at all.
Right. People want the answer, and that's what we're seeing with peptides right now and that whole world. It's very dangerous. And it's actually going to bite us in the butt, I think. That's the problem. When the government starts seeing that things are out of control, they start putting more controls on things.
Yes.
So everybody chill out and do this the right way, right?
100%.
What is your number one question? Okay, because you have a young viewership, right? On TikTok. What do you get? What do they want to know? What are they asking for from you? Because I'm sure it's not as pelvic floor stuff as much, I'm assuming, as it is nutrition and fitness. Yeah,
so it's a little bit of both. I started posting a lot more kind of pelvic floor stuff lately, and the questions I get in that realm, I'll do both. The questions I get in that realm are, should I be doing Kegels? And a lot of people they have seen other videos and they're like, my pelvic floor is too tight, what should I do? Or it's too weak, what should I do? And really, you don't know if it's too tight or too weak just based off of if you're leaking.
Right.
That doesn't always mean you're too weak. You could be too tense and the pelvic floor fatigues out. So again, another scenario where the answer is
one size
it depends.
doesn't fit all.
Yep. But then I can also just provide and give some general mobility exercises and stretches. Breathing techniques are huge. Those are like the foundations of pelvic health there. So those are some of the questions I get in that aspect. Fitness, nutrition-wise, it's always weight loss. And I feel like for everyone, it's, with the peptides, like why they're getting on it. With the GLP-1s, it's always, weight loss is always the big
Weight loss is the
big
driving
question.
Key.
Totally.
Yep.
Totally.
Sex, weight loss drives anything.
Yep.
Right?
Yep. And my comments are not about sex, but my DMs are about sex.
Right.
From people asking questions about themselves.
That's where I was going to go.
Yeah.
So for people that don't understand pelvic floor therapy, this is really surging because we have an epidemic in the medical space of UTIs. And uncomplicated UTIs, complicated UTIs, and also people that go in with pain to the urgent cares and are dying thinking they have a bladder infection and they're sent away because they have nothing in their urine.
Yep.
No nitrates, no white blood cells, and they leave with pain. And it's horrible. And a lot of this, not all of it, but a lot of this is pelvic floor dysfunction. Am I correct?
100% correct. That is the biggest question mark that I think there's not great information on the internet regarding what you can do about having basically UTI-like symptoms without a positive culture test for the UTI. And you can have a positive urine sample test, but if the culture is not positive, as you know, then it's not a true UTI. So it's like, okay, well, I'm not going to be given antibiotics. What the heck can I do about this? And you Google it, you chat GPT it even, and you're not given good information on it. And pelvic floor therapy is, according to the AUA guidelines of 2022, pelvic floor therapy is the number one most evidence-based treatment for this type of dysfunction and pain.
Absolutely. I think merging, if you're in urgent care right now, or you're a nurse practitioner, a PA, someone that sees a lot of this UTI coming in your door, and you get that positive, you get that reoccurring person coming in, and you get that positive trace. And what you do with that is you prescribe them an antibiotic, and then their culture comes back negative.
Yep.
You might need to go into a deep dive to pelvic floor. Sharing my story, I have something called interstitial cystitis, or at least what looks like it. It started a few years ago, late in life. I've had multiple abdominal surgeries from endometriosis. I'm older now. Things shift and change. Went into chronic pain. Never had a UTI before in my entire life. Just had this constant, brutal, 24/7, like I had a bladder infection all the time. Nothing worked. I was in misery. I was functioning through my day. I was trying to figure out, I was doing everything. And I decided to research, and I did a deep dive, and I found pelvic floor or pelvic Sanity, which is a local, they train everywhere too. They are the founders, really, truly, to me. She wrote the book on pelvic floor therapy, or interstitial cystitis, actually.
Yep,
right?
Nicole did the owner of the clinic. Yep.
Yeah,
yep,
the owner
the
of the
IC
clinic.
Solution book. Yeah.
And I read it, did a deep dive, and there's a reason why we use the word hysteria and histrionic personality and hysterectomy. It's hysteria, right? So women go through things and it's painful, and you're kind of shoved aside with antidepressants and whatever else we throw at you for this dysfunction. Anyways, I came across the clinic. I came across many amazing practitioners, and I met Olivia, and they saved my life. I had tension. Maybe explain to me what I had.
Yeah.
What I have. Explain to me what I have.
So what you'll see in the online and in the pelvic floor space, they'll call it like a hypertonic pelvic floor. So essentially the pelvic floor muscles are too tense. That can contribute to basically irritating the urethra, irritating the bladder, and sometimes you will get positive UTI results. So people who are listening to this, and they're like, well, that's not me because I had some that were positive and some that were negative. Well, with 2/10 of a pelvic floor, imagine you're like kinking a hose, you're squeezing a hose. You can't let everything flush out. Bacteria can harbor and just stick a lot more in that sense. So you can have 2/10 of a pelvic floor, especially with multiple abdominal surgery, scar tissue that affects and irritates the bladder. If you're lacking estrogen in the vaginal vulvar area and on the hormone route, you can be top tier with your hormone blood levels systemically.
Right.
But you can still be, and you can be on hormone replacement therapy, but you can still be locally deficient in the vulvar vaginal tissues, and the vulvar vaginal area and the urethra are very hormonally mediated, which means they respond really well to estrogen and other hormones as well. So if you're depleted there, it will deplete the function there. And then lastly, a big driver of interstitial cystitis and those types of symptoms is nervous system dysregulation. So if you are, it doesn't need to necessarily be your classic like childhood trauma that puts you in this fight or flight, but if you are a hustler, a busy woman, CEO, very go, high achieving woman. I see this a ton in high achieving women. So learning how to down regulate your nervous system. And that's not just like relaxing. It's proper breath work, finding safe spaces. It really, it depends on what you're specifically dealing with, and also like what you can do with your busy life, because you can't just quit your job, right?
Right. Most people can't.
Yeah, exactly.
And it can affect women that are at home with their children too, right? Anybody
100%.
that is hypersensitive or tense, like you said, that nervous system. I mean, that's where all of our nerves run out of, guys, is our spine, our nervous system. And those and that's one thing that you guys do there, is you actually work in those areas of the thoracic and loosen that area up a little bit. At least I feel like you're loosening that area up.
Yep.
You also see men with BPH, right? So you men out there that are up all night long, urinating 2 to 3 times a night, because that's not normal. 2 times a night is not normal.
Nope.
So 1 time is sufficient. If it's more than that, you may have some pelvic floor issues, or you may need to be assessed for BPH. But you actually see males as well.
We do.
You see males at the clinic, right?
Yep. I do see males at the clinic. It's probably maybe 5 to maybe up to 10% of our caseload. So it's not, as prevalent. But I also think it's not as prevalent because a lot of men don't really know that this is a treatment option, or just stereotypically speaking, once a man comes into the clinic, the issue is bad enough where they're coming out and seeking help with something like this sometimes, because it's all females who work in the clinic. Sometimes, of course, that can be, uncomfortable, but a lot of the time it's just exactly what they need. And once they are getting treated, they wish that they came in sooner, depending on, a whole array of what they might be dealing with.
They have pain as well.
Oh, yeah. Yeah, absolutely. So they can have very commonly like testicular pain, perineal pain. It can be erectile dysfunction, tailbone pain, muscle spasms in the rectal area, and a lot of, for men and women, low back pain, hip pain, groin pain, and injuries. If you have been going to an orthopedic or like a regular physical therapist for a long time and you're just not getting the results that you want and need, you might have an underlying pelvic floor problem that could be driving the issue as well. They're very, very related in that area.
Very related. And you can feel it actually, because I've done everything when it comes to physical therapy, and fitness strength also helps. Everything encompasses this. But
huge, yep.
What I'd like to talk about is what this appointment looks like, because this is the big unveiling that people are afraid of.
Yes.
What does this look like? I know what it looked like for me. It is very professional. But you do put your hands within the anus and the vagina.
We do.
And other places, your back. You work on backs, the legs. I mean, it's all over. But with such relief, I can't even tell you, you beg for these procedures, these treatments, because they actually you can feel the tension in your body. You don't realize how much is going on in that area of your body, and the relief you get even moments after leaving. That was my experience. And okay, everybody, a shout out to my favorite product ever. It's called Lucinergy from New BioAge. Why I like it is because it has resveratrol in it, B6, and something called leucine, a low enough dose to mimic exercise. I take 2 in the morning, I take 2 in the afternoon, and it hits all those longevity pathways. It helps push your natural NAD+. And I know you've all heard about this, so stop taking NAD directly. You want to incentivize your NAD so it goes down the right pathway so you can live long, healthy, and strong. Thanks, New BioAge. Does it help with vaginal dryness? Can it help with people with vaginal dryness as well?
So indirectly. So doing like the internal treatment is not going to help with lubrication, let's say. However, if your tissues are, like stuck essentially for whatever reason, then helping with some of that mobilization of the fascia, that connective tissue underneath and around that area can help and bring good blood flow.
Blood flow.
Yes, it'll help with the blood flow. It'll help with like the nerve conduction to that area. Because again, pelvic floor is too tight. You're not getting good blood flow to that area. And you're not getting good nerve conduction to that area. Kind of similar like kinked toes or a pinched nerve in that sense. But the symptoms just look and feel different down there than they would in your shoulder necessarily.
Do you find that people are undertreated with vaginal care, the women in postmenopause that are suffering they're optimized with their labs?
Yep.
But they're dry
100%.
down there, which stops them from having their intimate relationship with their spouse. Do you find that, do you guys have a cross referral or collaboration where you can get them the meds they need to insert in that area to help things?
Yep, 100%. Okay. So we'll do, the manual work or the coaching work that we need to do, but we're also assessing the area. So I'll do a visual exam and see de-estrogenization of the vulvar vaginal tissues. It might look, if you're looking for yourself, it might look a little bit white or in certain areas, or it might look more red and irritated in certain areas. And that's telling me that you might need a topical or a vaginal estrogen. Some people prefer the suppositories. I prefer, and again, I'm not prescribing them, but from what I see in the clinic, what works best for what we're doing.
Evidence-based knowledge.
Yep, is the creams, the vaginal estrogen creams, because you don't want to just insert it. You want to get it around the urethral area. You want to get it like on the bottom of the vaginal opening, and like you want to get it externally too. So we have, physicians, or if they can just go back to their own OBGYN or urogynecologist and it's actually a fairly cheap prescription that's pretty much always covered by insurance as well, that they can just go get, and that will really help our treatment sessions too. So they need to work like hand in hand together with that.
Because I'm sure some women that you're treating for the IC and other issues, frequency, or lack of it, you're doing these procedures and it's uncomfortable.
Oh, yeah. And they don't always help. The bladder installations where they're making kind of the cocktails, sometimes if they help, it's a short-term relief. And sometimes you do need that just to like get you going and get you through the rest of your week. But ultimately, you need to really work on the root cause of the symptoms to help with everything else.
Postpartum. So I feel like this has been your guys' connection to success. I feel like the introduction of this new young generation that's into everything, like taking care of themselves from top to bottom and their peritoneal area, things like that, has led them into your doors, which has opened the door to other things. And now you have this whole younger generation who's having babies.
Yep.
That is so incredibly excited and benefiting their future. One day they'll be my age. They will have this support system and this way they can help themselves in their either sexual future or just longevity, wellness, feeling well. So
exactly.
What exactly are pregnant people seeking when they come in the door?
Yeah, so it's kind of one of two routes we can go. Some people just want to be proactive, and they enter like more of like a healthy pregnancy program where we make sure that their breathing is top tier, their core engagement, they've got that down, their pelvic floor is actually not too strong. People want to get it stronger for birth. The pelvic floor muscles need to get out of the way in order for the baby to come out. Right. So we need to make sure that we have good hip mobility. The pelvic floor can be relaxed. We'll do peritoneal massage to minimize the incidence of potential tearing during birth. We'll do sessions where we find your best laboring and delivery positions. We'll bring a partner in and help with that for the labor process. So it's a lot of just education. It's like a labor and birth prep program.
Okay.
And then that rolls into, they'll have their baby. And then this is my favorite part, maybe 4 weeks, 6 weeks later, they're coming back in and we're rehabbing everything. And when you've done the work that we've given you during pregnancy, from what I see, their postpartum, just things are coming back online a lot quicker. They're having less pain, less issues. They're getting back into exercise if that's what they want to do, because we were working on the deep core the whole time. They knew how to breathe the entire time. They're following a structured program. So that's kind of one route if they're not coming in with quote unquote problems. And then we have, our pregnant patients who will come in and they're dealing with sciatic nerve pain, SI joint pain, pubic symphysis dysfunction. So we're just treating that essentially. But we also like to dovetail the pregnancy and labor and birth prep stuff too.
I love that.
Yeah.
I love that because I walk in there, I always see a bunch of pregnant mommies
All the bellies.
in there on the bellies, and dads with
bellies
them.
and babies.
And dads with them.
That's right.
I love it. I love it. And now
Yeah.
these women have access to this as they work through the seasons of their life.
Yes. Yep.
It's a place where they go, oh, and they're educated. I'm sure there's lots of education happening in those rooms because there always is.
Totally.
So there was one topic. Hold on, let me get my cheat sheet here.
Of course.
Because we're just chatting away. And we've talked about the urinary issues, which are really important.
Mm-hmm.
We've talked about vaginal health, which also is very important. Can this help women who have with desire? I've seen this on TikTok. They try to sell it as this will help with your desire. This will help with, does it? Bottom line, does this help with your sexual appetite and orgasms?
Short answer, yes. But it's also not the whole story, which is with everything in health, right? There's multiple components. But again, back to the blood flow, the nerve conduction, also the upregulated nervous system was as well, getting back into your parasympathetic nervous system. And I realized I never answered your question on what an exam looks like, but we'll also do like vagus nerve stimulation. So the vagus nerves, it's a cranial nerve, comes out of the brain, goes down the neck, underneath the collarbone, around the heart and lungs to the abdominal and the pelvic organs too. And it's in charge of getting into that rest and digest zone and getting out of that fight or flight essentially. So we'll do a lot of like manual work to stimulate the vagus nerve to really help with that. So we'll do a little bit of that manual therapy, the manual therapy that you had mentioned, and then the internal pelvic floor muscle assessment and treatment where, you just glove, lube on the finger, and then you have to, that's the only way to get to all of the pelvic floor muscles is intravaginally, or you can do it rectally as well. And you're just really kind of releasing
lots of tension
muscles in that area.
Lots of tension.
So when we're doing that, there's also nerves that we can access in that area that will stimulate, just again, get that back online, get blood flow back online, making sure that there are no restrictions in the the clitoral hood, which is really necessary for orgasms as well.
Very necessary.
Yep.
So you guys deal with that too?
Yeah, absolutely.
Amazing.
You need good strength and length of the pelvic floor muscles in order to have an orgasm, because an orgasm is rhythmic contractions of the pelvic floor. So if it's too tense or too weak, it can't, get over that edge, and you're not gonna achieve that.
Tension. Type A, tension. This is all a biofeedback. It can get in your head. It can stop you. This is a fantastic resource. Constipation. It works. This works great for constipation. When I was coming regularly, this is the beauty of it. You go through a series of what you need, because it's all individualized care. And then you're kind of let loose. You're kind of, here you go, and you're taught skills and techniques. I have balls at home that I sit on. I roll on. I have a wand that I have to use, that I go up, that I've been taught to go up and release the pressures that you release.
Yep.
If I can't get in to see someone, or you have an urgent, there's like a lot. You get like a little mini PhD course in your own self when you go through this at Pelvic Sanity, or I feel you do. But constipation, tell us about that and how it helps.
Yes. So first off, we can treat constipation just in and of itself. So I have people coming in for constipation. If your pelvic floor muscles, again, a lot of it is too tense. Like I see more too tight than too weak. If your pelvic floor muscles are too tense, especially in like that backside or like that rectal area, that can, affect obviously
elimination.
Stool coming out. If you feel like oh yeah, I go every day, but I need coffee, but I need fiber, or psyllium husk, or I go every day, but it's, I feel like I'm not completely emptying my bowels, or it's nuggets. That's still constipation. So it's not just diet and fiber, it's being able to like release pelvic floor muscles, because then over time you can get desensitized in that area where you rarely get an urge, or if you do go, you don't feel that urgency to push, or you have to strain.
Use laxatives too much, or even glycerin laxatives to get it moving.
Yes. And then laxatives are not great because it teaches your bowels that they don't really need to work as much. So you become more reliant on those supplements.
The body's really smart. So if it gets outside resources, it'll use that resource to utilize another part of your body.
Yes.
Same way GLP-1s and GIPs and what we're seeing with peptides is if you overstimulate and give outside mechanisms to the body will just say, okay, you're doing it for me. I'm gonna stop. I'm gonna pass. And then you deal with things like not atrophy, but it just stops working.
Yeah.
And it's tissue, so it can atrophy.
Yep.
What about constipation and peptides? Are you seeing a lot of this in your clientele?
Yes, I am. I'm seeing a lot of people who are on more so just the GLP-1s. I can speak mostly to if they're on seemingly either too high of a dose, or the issue is not the GLP-1s. I'm not anti-GLP-1.
Right.
Even as a fitness and nutrition coach, I'm not anti. I work with clients with who are on GLP-1s, because if you are on it and you don't have the proper coaching, so you're eating less, you're not eating fiber, you're not eating protein, not drinking water, that's a huge one. If you're just not eating enough and you don't have enough bulk to push things through, you're not going to have bowel movements, you're going to have GI upset, a lot of bloating, a lot of distension, and I'm seeing tons of that. So a lot of times I'm doing my manual work and I'm doing colon massage stuff as I'm educating on what are you doing for water? Let's do a food log. So it really, yes, we're treating bottom up, but then especially just with my nutritional coaching expertise, I'm also talking about some top-down stuff as well.
Top down.
And what else I'm seeing with the GLP-1s is people who have lost weight too rapidly and are not strength training, are not eating enough protein. They are losing their muscle, right? But they're also losing their muscles of the pelvic floor, and they're having atrophy down there, and they're getting more leakage. They're getting more pain with sex. So I am just seeing this spiral in so many
and
different
slowing
aspects.
down. I mean, face it. I'm all about peptides. That's my passion.
Totally.
But it's in some ways, I just want people to be aware that it goes rogue. Everything can go rogue. And if you don't have a gatekeeper, you can get in over your head with this. And it can actually turn something on or turn something off that your body turns off the ability for your bowels to move.
Yeah, it slows
goes to
gastric
sleep.
emptying, and yep.
And that can over time cause issues. So then we're upping our doses, or who knows what we're ordering these things from and what we're getting inside them, and that's going in our body. I think that this pelvic floor therapy is really, really, really going to blow up even more, because we have a whole generation coming up that has gut issues.
Major. And people are just starting to tap into them, I feel like, and care about their gut health a little bit more.
Yep. And a lot of it starts from the anus up.
It does. It
Believe
does.
it.
Bottom
It's
up.
here and in your anus or in your vagina. That's your exit zones. And what you put in the body and what you do to the body, how you treat the body. Also, what you eat. But let's talk a little bit about fitness. Now, are there any contraindications when it comes to somebody that you're treating, possibly in saying, lay off the gym?
Right.
Or do you encourage it? Or does it just depend again?
It always just depends, of course. But I'd say I and every therapist is going to be different on this. I have a bias as not just a fitness coach, but as someone who regularly goes to the gym and, you know, we bonded over this, lifting heavy weights. And it's just, it can feel like a good stress relief. The last thing I want to do is tell you to stop working out, because what will that do to other aspects of your health? If you start losing muscle, if your mental health is declining because of it. So that is the last thing that I want to tell you to do. What I will tell you to do is potentially modify. So if you're going crazy in the gym, you're going 6 days a week, you're doing these HIIT workout classes, you're not eating enough to recover, and you're just so go, 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 then we'll talk about how you can still do it, but recover properly. We'll modify the workouts a little bit more so you're still getting that, but it's a little bit more in line with your goals and in your rehab journey for the short term. And then let's see, once we're in a good spot, we'll see if we can ramp it up a little bit more. Or if you are going to do these strength exercises, let's say, but I need to make sure that you can breathe properly when you do them, that you're bracing your core appropriately and you're not bearing down on the pelvic floor. So we can do standing pelvic floor muscle assessments, because 9 times out of 10, you're not getting symptoms when you're laying on your back. And that's how I'm doing the assessment and the treatment. It's when you're standing and you're moving.
Like, I think it was you that we did, you watched me squat.
Yeah. Yeah.
And how my leg turned out, or the way it really told you a lot about my pelvic health.
Yes, exactly. Because again, things work up the chain. You can have flat feet. And if you have flat feet and you're running improperly or lifting improperly, then the force that's going up from the ground, the pelvic floor has to do a lot more work. So again, that's why we need to work on everything outside of the pelvic floor to help the pelvic floor.
This is why it's important to have a physical therapist that has the education and overall well-being of the body from head to toe to do I think they're the only ones licensed. They should be the only ones licensed to do pelvic therapy, right?
Yeah.
Or can a nurse do that?
No,
I didn't think so.
An occupational therapist can do
Okay.
it. So there's pelvic PTs, pelvic OTs, but we're the movement specialists. We're the only ones who are really, and that's why I love the profession as well. We're the only ones who really are the experts on the pelvic floor muscles, not OBGYNs on the pelvic floor muscles, not urogynecologists, not orthopedic physicians. So this is our wheelhouse.
How did we get here, though, when you think about it? It used to be the only people that could stick their hands up inside you was an OBGYN, right?
Yeah. Mm-hmm.
So how are we here with physical therapists? Well, and nurses could do like rectal exams. That's even been taken away from them.
Oh, really?
Yeah, they're not allowed. It's in
wow.
California.
Okay.
You're not allowed to do a digital rectal exam anymore, or evacuation technique. It has to be the physician.
Okay.
So I'm interested, like, was that in the physical therapy world, has that been pushed, a movement that has been lobbied for?
Yeah, definitely. So there's always guidelines on like what we can and can't do, let's say. And in the beginning, decades ago, people if we're the only ones learning about the pelvic floor, we learned that this is kind of the only way to do it. And in the beginning, there were no rules and regulations. So certain people kind of pioneered this, and they're like, this is how we're going to do it. And they just kind of
went for it.
Started to do it, like whether that's ethical, whether that's not. I mean, you can't say yes or no because there weren't guidelines, and people were getting better. So then that leaned into them kind of just taking it to the physical therapy board, making sure that there are certain, courses that you have to and need to take to become an expert. But even still to this day, it's still a little bit of a gray area.
It's like liability and risk of being sued and all that
100%
is just so frightening. So I'm glad there's probably you guys have great insurance, right? Because you have to.
Yeah,
I mean,
consent
nowadays,
forms, up the
consent forms,
wazoo,
the
yeah.
whole thing.
Yeah.
This is it's really a medical.
It is
treated like a medical procedure, and everyone is. This just gives hope to a whole group of people that are ailing from ailments that did not know. I know so many people that suffer from pelvic pain and they think it's just supposed to be that way.
Yeah.
Or they have UTI symptoms, but they don't have a UTI. Or they think they have chronic UTIs. Or they're just perimenopausal. There's so many things, and this is such a fantastic resource. And I am such an advocate for it. And the more we can collaborate with our facilitators in longevity and pelvic floor and with OBGYNs and our functional docs and bring this all, urologists, bring this all to the table, this is going to be fantastic for our overall, and nutrition and fitness. This is going to be fantastic for our overall vitality moving into the future. Right?
100%. Yeah.
Constipation. It works for constipation.
It does. She does.
She does. And they know what they're doing. And how do we find you, Olivia? She's probably pretty easy to find, but there's a couple different ways: TikTok, Instagram, and she has a website. So go for it.
So I'm on both TikTok and Instagram. It's at LiveWellVG, LiveWellVG. My website is also livewellvg.com. However, it's kind of under construction right now.
That's good.
So just those two platforms. Currently working at Pelvic Sanity. If you want to see me in person in Laguna Hills, and then also depending on when this episode is going to launch, I'm also about to launch a new online offer of pelvic health coaching virtually as well, just to add some extra support there. So that will be coming up.
Let's start with your one tip then. What is the one thing we can do at home for our pelvic floor health?
I'd say something that everyone can do more at home is not just in case peeing. We call it no jicking, no just in case peeing. So if you're about to go to the grocery store and the grocery store's 10 minutes from you and you don't have the urge to pee, don't go pee just in case. You're training.
Like what we tell our kids, go into the bathroom, go pee. We're going on a lot, go pee.
Yes, exactly. You don't need to go right when you get somewhere, right before you go somewhere. As if there's going to be a bathroom at the location, if you're not going on a 5-hour road trip, don't initially go, because you're training your bladder to go when it doesn't need to.
The weak, like that signal.
Yes,
Of a
exactly.
drip in your bladder.
Yep, it affects that. It's called the micturition reflex. It affects your brain, it affects the bladder and that connection. So we got to go in and disrupt that.
Yes, that's like a bladder infection.
Yes.
Like that constant chronic, I need to go. You're encouraging that kind of sensation, right?
Exactly, yeah. And you won't be able to hold it as long. Yeah.
So don't go just in case. Is there
It's
an
your homework.
exercise we can do?
Yes.
Menopausal women and premenopausal women, is there an exercise we can do for our lower extremities to help with our vaginal health and our pelvic health?
I'd say adductor rockbacks are my favorite. So it's a universal term if you want to YouTube it. You're on hands and knees, but then one leg is straight out to the side and you just rock back and forth. That will really stretch and mobilize your inner thighs and that first layer of the pelvic floor muscles there. So that's a good one.
All right. We're going to have that in the link as well, so you guys can check it out with the link to Dr. Olivia. I've brought you into my world to share with you this was very personal for me. I mean, I talked about my constipation. I talked about my IC and my vaginal issues. And this one helped me. So thank you, Dr. Olivia.
Thank you so much for having me.
And we know you're going back to work. But
I am.
here on the Beauty Outlaw, we always do a toast.
We can toast.
So we're going to toast to
Thank you.
all things prostate, penis, and vagina.
to
How about
prostates,
that?
penises, and
Pelvic
vaginas.
floor health.
Cheers.
And fitness and wellness and strength
Correct.
and coaching and finding somebody amazing in your life to help you with all these things. Look her up. She's amazing, totally amazing. And I'm so proud of you.
Thank you, Jerry.
And thank you for being on the Beauty
Of
Outlaw.
course. Thanks so much for having me. It's so much fun.
See you next time on the next episode of the Beauty Outlaw.